Morning and welcome back. Radiation therapy plays a crucial role in treating breast cancer, but it can also bring challenges that last long after treatment ends. Managing these impacts is a key part of a patient's recovery journey. So joining us today to tell us more about it, Dr. Juhi Purswani, breast radiation oncologist at Hartford Healthcare. Doctor, first of all, thank you so much for your time today. Good morning.
Good morning. Thank you for having me on.
Yes, we're about to wrap up October, but it's important we talk about this all month long. Can you help us explain some of the most common acute side effects that patients experience during breast cancer radiation and how they may be managed effectively?
Yes, absolutely. So, one myth about radiation to the breast is that I often have patients coming in saying, they're nervous that their skin is going to burn, it's going to blister. And this is very rare. In most cases, the skin is not the target of the radiation unless the breast cancer specifically has infiltrated the skin. What we often will see is this faint erythema, so a faint redness of the skin in patients who are getting whole breast treatment or 3 or more weeks of radiation. Patients with skin of color specifically may notice not redness, but a tanning of the skin, so a mild darkening of the skin, and this can sometimes itch and it can cause discomfort. A lot of patients who are getting shorter courses of breast radiation will rarely see these skin color changes. What we do to manage this is really we're very proactive from the start of radiation. So from day one onwards, before I even see any of those skin changes, I often will prescribe my patients a topical steroid cream to really reduce the inflammation caused by radiation, and prevent it from becoming sort of some of those higher grade changes that we see. I will put film barriers on the patients, and sometimes patients are really interested in holistic treatments, more natural treatments. So there's great data for things like olive oil and honey, and really using that from the start of radiation on the skin to prevent that reddening.
Wow. And what are some of the late or long-term effects of radiation therapy that patients should be aware of? Cardiac toxicities. You also hear about fibrosis. What can you tell us?
Yeah, absolutely. So, with advanced techniques in the modern day, we rarely see long-term damage to the heart and the lungs. We do a lot to sort of minimize that. For example, patients with left-sided breast cancer, where the breast tissue is near the heart, we do this technique called a deep inspiratory breath hold, where we actually have patients hold their breath during radiation, which moves the heart further back and away from the breast tissue to prevent any kind of long-term cardiac exposure to radiation. We sometimes even position patients on their stomach so the breast can actually fall away from the body and again minimize radiation to the heart and the lungs. Fibrosis is this process of scar formation. We do more often see that in the long term, where the breast tissue just becomes more firm and more dense with scar tissue. And we often will most patients don't have any pain from that, but if there is discomfort from that, we'll manage that with pain medications.
Wow, so important. Dr. Juhi Raswani, thank you so much for your time today. Really appreciate you talking to us. Very important, and of course, all that Hartford Healthcare is doing to support patients. Thank you.
No problem, my pleasure.
And we'll be right back after a short break.